And welcome back to Talk of Alabama. You know, summer is right around the corner, and that means children are busy already playing outdoors. It also means it's peak season in emergency rooms and doctors' offices. Today, we've got two doctors here, Dr. Cherie and Dr. Ricard Colberg with the Andrews Sports Medicine and Orthopedic Center, here to really educate all of us about summer sport injuries, especially with our youth. Welcome to both of you.
Thank you. Thank you for having us.
So you guys are both non-surgical doctors. What does that mean exactly?
Right. So non-surgical sports medicine, we treat musculoskeletal and orthopedic injuries that don't require surgery. Fractures, dislocations, sprains, strains, concussions, overuse injuries. If while we're treating you and working you up, we find that you do need surgery, we'll get you an MRI, whatever else is needed, and then quickly get you to one of our partners at Andrews Sports Medicine for a surgical consultation.
Okay, and a lot of people I think are under the misconception that you guys just work on adults, and that's certainly not true, right?
That's correct. So at Andrews Sports Medicine, we've created a youth sports medicine program. In fact, when you look at the United States, the data, over 40% of all injuries occur in children 14 years and under. And over 90% of those injuries can be managed conservatively and don't need surgery. Now, regardless, most cases, parents will take your child to the emergency room. And most of these injuries are not severe enough to warrant going to the emergency room, and the ER doctor will tell you, go to an orthopedic physician to be evaluated. So you end up doing 2 trips. And at Andrews Sports Medicine, we've created the Youth Sports Medicine program to facilitate the access and taking care of these injuries. So we have 4 doctors, Dr. Miner and myself, Dr. Ortega and Dr. Casey, and we're trained in taking care of these injuries in children.
And I think for the parents out there watching this morning, it's important that you guys clarify that the children are not little adults, right?
Correct. So children are growing, so they have growth plates within their bones, and their bones are more susceptible to different types of injuries. So you have to be aware of what those injuries can be. Dr. Colberg and I have had additional training in pediatrics as well as the adult sports medicine. So we'll see patients from age 5 and up and treat their issues. And really, we want to get their acute injury better. We want to educate them on overuse injuries and the different injuries that can happen in children, and then get them back to their sport, quickly but safely.
Well, that begs the next question, really. What would you tell parents out there, advice for those that have children with these acute injuries?
Well, there's 3 main things that I would recommend. The first one is don't let your child play through pain. Okay. It's not normal for kids to be hurting. If they're hurting, there's something going on. The second one is if you have an acute injury, practice the acronym PRICE. Protect the area, rest it, ice it, do gentle compression, and elevate the area. This is going to help manage the bruising and the swelling and help ultimately in the recovery. And the third one is to go ahead and call our office. Our staff is trained in helping you determine if the injury truly needs to go to the emergency room or it could be evaluated straight in our office.
Well, and speaking of that, you've got more than one location, right?
Right. Our main office is downtown St. Vincent's. We have a satellite office in Greystone on Highway 280, another satellite office in Pelham right off I-65.
Okay. Well, and I guess in closing, what's one message that you really want to tell parents out there watching right now when it comes to summer and summer injuries and all the kids out playing sports and wrestling on playgrounds right now?
Well, just bring them into the office if they get an injury or get them evaluated. We don't want to ignore it. And they can call our office at 205-939-3699. They can go to our website, Andrews Sports Medicine, for more information. We'll certainly try to get them back to play and back to their sport as quickly as possible. And
better to be safe than sorry. I'm sure with 2 little boys at home, I will be visiting you guys at some point in the next several years, because I can just always see those accidents waiting to happen as they love to wrestle, little boys. AndrewSportsMedicine.com, the website and phone number on your screen, and again, multiple locations. So go right away if you've got an injury at home, either yourself or your children. Thank you guys.
Thank you
so much, doctors. We appreciate it.